Hey everybody, we're going to continue our newborn instruction manual today with a discussion of umbilical cord care. Live from the Hive, I'm Dr. B, and this is The Buzz. The umbilical stump is what's left over after the baby has been unplugged from the mom. And this is a freshly cut umbilical cord, and you can see these little white dots. Those are blood vessels. Those two really distinct ones are two tiny little umbilical arteries, and to the right there's a little less conspicuous one. That's an umbilical vein. That's a little harder to see. But I think it's pretty amazing when you think that these three blood vessels are all that was hooking the baby up to mom. And we've just nicked them, and the baby's on its own. Once the umbilical cord is cut, it's going to start drying out and start to look a little bit like beef jerky or bacon. And that takes about 1 to 2 weeks before the cord falls off. Now, the nursery staff may have told you, don't mess with the umbilical cord. Don't pull on it. Don't wash it. Don't put alcohol on it, anything like that. If you listen to them, it's going to take 3 or 4 weeks or more for the umbilical cord to fall off, and it's going to smell bad. So we're going to tell you what to do instead. This is a pic of what it'll look like when it starts to dry out. And what I recommend is cleaning it once a day with a little bit of alcohol. You can get some of those alcohol swabs at a grocery store or at a pharmacy, or you can get a bottle of rubbing alcohol and just dip a Q-tip in it, and you can use it that way. So what you do is you take that stump in hand and you just push down on it towards the diaper, and then wipe above where you see that the umbilical cord actually connects to the skin. I don't mean wiping up on the belly. I mean pull down on that cord, and where you see the very base of it where it attaches to the baby, that's where you want to wipe with some alcohol. And then what you want to do is push up on the cord towards the baby's head and wipe underneath it the same way with a little bit of alcohol. That's going to keep it from smelling bad. And here's another picture, and this is a little bit later on, and it's starting to look like fuzzy bacon is what I like to call it. This is fuzzy bacon, and you can imagine that if this isn't cleaned regularly, just cleaned once a day at least, it's going to start smelling pretty nasty. So I definitely recommend cleaning this once a day with alcohol. Now, there's one more thing I forgot to mention. I can't believe that I forgot, because it's an incredibly common question. And that's, what do I do if the belly button gets wet? Well, the kid's not going to explode. All you have to do is dry it off with some toilet paper or a face cloth or something like that. Apply some alcohol to the cord, just the way we talked about, and try not to do it too often. Try not to get it wet too often. It can get kind of sticky. You can get kind of smelly. So you want to keep it as dry as you can. But if it gets wet, it's not a big problem. Dry it, apply some alcohol, and just go on with your day. Now, after the cord is cut, there is a clip that they put on the cord to make sure that it doesn't ooze any blood or anything like that. And that clip, sometimes they forget to remove it when the baby leaves the hospital, and the babies will come to our office still wearing that little plastic clip. And this is what it looks like. Do not worry about that. We do have a special tool in the office that we can use to cut that off, and we'll take care of it once you get there. And one thing people worry about quite a bit is umbilical hernia, or a big bulgy belly button. This here is an umbilical hernia, which means that there's a defect in the abdominal wall muscle, in the muscle right around where the belly button goes in there. And you get this big bulgy belly button. And most babies, while the cord is attached, it'll look like they're going to have an outie, like they're bound to have an outie. But most of the time when the cord falls off, the belly button will start to go in, and it's going to look like the usual any type belly button. And I want to stress that there's nothing you can do to make this kind of bulgy belly button happen. You're not going to do something wrong and wow, now you have an umbilical hernia. It's really just chance if your baby is going to get an umbilical hernia or not. So don't think, if I don't take care of this belly button just the right way, this is going to happen. No, it's just that sometimes, rarely, a baby will get an umbilical hernia. There'll be a little defect in the wall and it'll bulge out. If your child is left with an outie like this, it's still very likely to go away over time. So don't lose sleep over it. we'll discuss what some warning signs might be in the office. We'll talk about this and tell you, what the warning signs might be if there's going to be a problem with this belly button. Now, a lot of people get concerned about an infection of the belly button, a bacterial infection of the belly button called omphalitis. Obviously, that would be a worrisome thing, but it is just not common. In all my time in medicine, I have never seen a case of bacterial omphalitis. Yes, it does happen, but it's so rare that I don't think it's something you need to be worrying yourself about. Just do your best to keep the belly button clean, and I'm sure everything will be fine. Well, that's today's Buzz Parenting and Pediatrics with me, Dr. B. Make sure you like and subscribe and come back later in the week for Dr. Julie's Friday checkup. That's going to be a lot of fun. It'll be her first really medically related Friday checkup, and I'm excited to see what she comes up with. Thanks for visiting today, and we'll see you next time.